This is breaking news.
Mayor de Blasio is giving an update on coronavirus in New York City. Let's go to it now.
We have to make sure at all times we are continuing to refine our strategies and approaches. And that means we always need to be ready to make changes and adjustments, to prepare ourselves for everything up ahead. And anytime there's change, there's an opportunity to rejuvenate, there's an opportunity to rethink and go forward with better approaches. And that's what we intend to do. We have, over these last months, realized all the things that we need to learn from the coronavirus crisis. All of the big changes we need to make in our city going forward, all the ways we need to prepare ourselves for the future. We've looked at hard, difficult inequities and disparities, and we realize we have so much to do to address them. But we've also seen things that make us so hopeful as New Yorkers: the extraordinary strength of our healthcare system, the resiliency of our people, the way we fought back. Remember, we were the national epicenter of this crisis. And now, all over the nation, people are looking to New York City to understand how to fight back against this disease. And the credit goes to every one of you, and the credit goes to our healthcare heroes, our doctors, our nurses, our hospital staff, and of course, all our colleagues in government, at the health department, at health and hospitals, at all the agencies have worked together to address this challenge. Earlier today, just in the last hour or so, I received a letter from the heads of one of our agencies, Dr. Oxiris Barbot of the health department, informing me of her resignation. I want to thank her for her service to the city. I want to thank her for the important work she did during this crisis. And everyone had to give their all, and I know she did, to help us work our way through. So I want to thank the commissioner, because it was a tough, tough moment for the city. Everyone had to do their best to come up with new approaches in the most difficult of times. And I want to thank her for her good work in addressing the crisis. Now, obviously, to move forward, to continue to be the city that rebounds from this crisis, to continue to be the city that can deal with whatever new challenges ahead. And we know there are many on the horizon. The deep concern that we all feel about the potential of a second wave, the challenge of the flu season coming, so many things ahead. I knew it was important to have a new leader for our Department of Health who could bring together the skills we need at this moment. Someone who could be a manager for that great department, a leader, a visionary in terms of the things that we would have to do in a brand new equation ahead, someone who could communicate that vision, someone with great healthcare credentials who also knows our city and our people. And someone ready to fight this fight because he's been involved from day one in addressing the coronavirus challenge and understands what it takes for us to overcome it. And crucially, someone who understands that we cannot allow the disparities of the past to continue. So remember, we're fighting an immediate challenge with the coronavirus. We have some very big challenges in the months ahead specifically, but then the even greater point, bringing the city back and addressing the underlying disparities, particularly in healthcare. I know we need a leader who can do that. The person I'm about to announce to you has an extraordinary history. Child of immigrants, grew up with tremendous potential, and worked so hard every step of the way to realize that potential. A Rhodes Scholar, a White House Fellow, someone trained to some of the best institutions in our nation, someone who has worked all over the world providing health care to people in need, but most especially right here in New York City, for years serving at the front line, and who played a crucial role in those worst days in March and April, helping us to fight through the crisis. Someone who feels a lot of compassion for the people he serves and still sees patients every week as part of that commitment. I can certainly say this is not the first crisis he has been through. The coronavirus was not his first big challenge. He worked in Louisiana after Hurricane Katrina. He was here in New York City as part of the response to Sandy. Again, played a pivotal role at health and hospitals addressing the coronavirus crisis, and did it by creating a team approach, an approach that focused on compassion for all the people we serve, but really brought together the very best of the efforts of different agencies and different people to achieve what we needed to in a moment of profound challenge. When health and hospitals, the biggest public hospital system in America, had to prepare to add not just thousands, but tens of thousands of beds to accommodate people because of the coronavirus. This is the person who was charged with the task of building out that plan. When it became clear we'd have to depend on telemedicine more than ever because people couldn't get to health care appointments, this is the person who, in the space of just a few months, ensured that health and hospitals operations were maximizing their telemedicine capacity, reaching tens of thousands of patients in a new way. So this is someone who knows how to take on any challenge and do it with fairness and compassion and tremendous effectiveness. I've seen it with my own eyes. My team here at City Hall watched his work with tremendous admiration. And so it's my pleasure to introduce to you the next Health Commissioner for the City of New York, Dave Choksi.
Thank you, Mr. Mayor, for that warm introduction. Colleagues, I'm so honored to be here before you today and ready to get started with the important work of safeguarding the health of New Yorkers. I'm a primary care doctor with a public health heart. As the first doctor in my family, I didn't have direct role models showing me what it meant to practice medicine. But I had plenty of experience, from getting hospitalized with asthma attacks when I was a child, to my father's decades-long challenges with diabetes that showed me how health was linked to opportunity. Opportunity is what propelled my grandfathers to take up and move from small villages in Gujarat, India, to Mumbai, the New York City of India, 2 generations ago. My father was the first in his family to immigrate to the United States, settling in Baton Rouge, Louisiana, where I was born and raised, because it was where he could find a job. My wife, Melissa Aguirre, who is here today, comes from a family with one of those only in New York stories. Her Dominican mother and Argentinian father met through a family matchmaker at JFK and raised their 2 daughters in Queens, where they still live and where my wife and I are now raising our baby daughter. Through our family stories, I can tell you that my work is personal. The patients I take care of every week at Bellevue Hospital, often immigrants working as taxi drivers or housekeepers, remind me of the journeys of so many of my and my wife's family members.